So in this podcast, we're going to discuss shaking before you have a look at the techniques. So this is a whole region technique and you are shaking a limb and you're trying to do it in a smooth fashion with a good rhythm. So you are physically picking up the limb and moving it around. It's quite hard work, this one.
Certainly can be. So if a client is struggling to let go of a muscle or joint, this can be a really good technique to utilise. It can be slotted in whenever you need it into the massage, but generally I wouldn't use it at the start of the treatment. You're going to tend to want the area a little bit more warmed up first, and often it'll be useful when you're finding that you can't actually get the muscles to give, you need a little bit of help. So that's where this mobilisation can help. So technique is more about relaxing the muscles and getting the clients to mentally let go of an area. Often by actually effectively moving it around for them, they start to sort of believe it can move, and that makes a big difference. It will also draw the nervous system's attention to it, which again starts to create muscle relaxation and will allow the joint to move much more. Might be really useful technique as well to have in your toolbox for an event, because really easy to do with your client dressed.
Definitely.
So technique I've had some really good results with, and I know Tamsin has as well. In people, especially with decreased range of movement, it can be really useful for just getting a little bit of extra movement in that area.
Cool. So this is for limbs only. Don't try and do this on the neck. It's really not suitable. So there's a couple of ways of doing this. You can either have your limb straight and then you just traction it slightly at the joint so that you just pull away slightly. Or you can have it with the joint bent. So if, for example, you're doing the leg, you can have it bent at the knee. And if you're doing the arm, you can have it bent at the elbow. You can then either do this technique with no movement, so you're just shaking it where it is and not moving the limb through a range of movement, or you can do both. You can shake it and take it through a range of movement. Just be careful how far you take it. You don't want someone doing the splits that's really not capable of it.
Yeah, don't keep walking when they've reached the end of their range. So there are a couple of other things you need to think about while using this technique. So firstly, the size of the client compared to you. Don't try and take on someone that is a lot bigger than you, because you're going to be at risk of an injury to yourself. So that's not really worth it. You also need to think about the age of the client, the condition of their joints, and the problem they've come in with. Also, will this technique actually cause them pain? Is it going to be suitable for them? So for example, someone with a frozen shoulder, perhaps arthritis, or someone who's really guarding the joint, very nervous about moving it because they're in pain, certainly isn't going to want you pulling it about, tractioning the joint and shaking it up and down. So make sure also your client knows exactly what you're going to be doing.
Very important.
If you've got any concerns, just use shaking or perhaps rocking instead, or vibrations, or rocking instead. That would be a much better option if you're unsure.
Let's have a look at the videos.
Think so.